Indigenous healthcare reconciliation in Canada. The term Aboriginal is utilized in this presentation only to reflect the original Truth and Reconciliation Commission statements. Otherwise, the term Indigenous is used with the respect in place of Aboriginal, First Nations, Inuit, and Métis. The Truth and Reconciliation Commission of Canada calls to action. The Truth and Reconciliation Commission formed with the intention to reveal the truths and history of Indigenous residential schools and begin the process of healing, leading toward reconciliation between Indigenous peoples and non Indigenous communities, governments, and Canadians generally. The TRC released 94 calls to action, which provide instruction and recommendations to guide governments, communities, and faith groups down the road to reconciliation. Health Recommendation 23. Of the 94 calls to action, there are 7 that are directly related to Aboriginal health and are in place to improve the health of Aboriginal peoples and communities. This action plan is specifically focusing on Recommendation 23.
23. We call upon all levels of government to 1. Increase the number of Aboriginal professionals working in the healthcare field. 2. Ensure the retention of Aboriginal health care providers in Aboriginal communities. 3. Provide cultural competency training for all healthcare professionals.
What is the issue? A lack in the number of Indigenous healthcare professionals to provide culturally equitable care to Indigenous populations. 1.2% of all Canadian health professionals are Indigenous health professionals. In Canada, there are 13,010 health professionals that are identified as Indigenous, of which 9,695 are nurses. Indigenous people make up 3% of the RN workforce, but form 4.9% of the overall Canadian population.
Rose McDonald sings, praying for the patients she once worked with at St. Paul's Hospital. She can't be with them today because her job as an Indigenous health and wellness worker was terminated.
It felt like a slap in the face, not just for me and my colleagues, or what I'm feeling about my colleagues, but also just for the patients, at St. Paul's and any other Indigenous person working in there.
On November 12th, she was told her unionized position no longer existed. 4 days later, 5 new non-union Indigenous liaison positions were posted that require a Bachelor of Social Work. Providence Healthcare, which runs St. Paul's, says it was restructuring in response to Mary Ellen Turpella-Fawn's report addressing racism. McDonald disagrees.
It was extremely colonial, with a colonial agenda. It didn't feel like there was, an Indigenous aspect to it. To me, it felt like slapping an Indigenous mask on a colonial idea and calling it an Indigenous idea.
3 other Indigenous women also lost the same unionized jobs.
I was actually quite shocked because the way I'd heard it was from community, from patients that were accessing the services. And I grew relationships with some of the patients that are currently in St. Paul's.
She worries the new positions don't take into account the spiritual and world views of Indigenous people. Health Minister Adrian Dix told CBC News that he was unaware of this decision until CBC ran the story, and he's not the only one.
I was never briefed that that was happening for that reason, and one would expect at least a plan to be presented to me and explained to me. And then certainly just in observing this, I'm not very impressed by the way it's been handled in terms of the treatment of people.
The Hospital Employees Union told the CBC it found the termination confusing and is fighting for the women to keep their jobs. Angela Sterrett, CBC News, Vancouver.
Also, a need for cultural safety and humility training for all non-Indigenous health professionals. In a survey conducted by Healthcare Canada and Canadian College of Health Leaders, only 1/3 of Canadian health leaders stated that they have Indigenous cultural safety commitment in their organization.
A lot of people still think of things like cultural safety and cultural awareness as acquiring skills and knowledge when it's actually about challenging the skills and knowledge you've been carrying for many, many years.
I think it's important. I think there are hundreds and thousands of instances where information has been collected about us and it does not represent us. And if you're going to be sitting in a position where you're providing this information to community, to anyone within our community, then you need to be aware of the implications that it will have. And the cultural competency training will do that for you.
You will learn things that you didn't know that you didn't know.
The difference I hope to see in my library following this program is that I hope people can see ways in which they can work better with their Aboriginal and Torres Strait Islander colleagues. And I hope as if they feel empowered and more confident to take the initiative and really look for ways in which they can incorporate Aboriginal perspectives into the work that they do.
Even as an Aboriginal and Torres Strait Islander person, I'm still learning my own, culture, my own mob. We're all different as well. So it's important that we all have this at least training and understanding, and it's a start. It's a journey that will continue forever.
Why is this an issue? In the Healthcare Canada CCHL survey, 51% of healthcare leaders stated that there is race-based discrimination against Indigenous people present in their organization and is therefore an evident lack of cultural safety and humility training. More than 1,000 members of the public found that half of Canadians believe discrimination of Indigenous peoples exists in healthcare. Indigenous peoples are reluctant to access healthcare services for fear of disrespectful treatment, cultural appropriation, commercialization, unbalanced funding schemes, tokenism, loss of autonomy, and lack of understanding of Indigenous health issues. Why is this important? Indigenous peoples feel as though non-Indigenous healthcare professionals do not understand how to interpret their illness experience or properly respond to treatment regimens, and therefore require cultural safety training to not impose biases and provide patient-centered care. Indigenous healthcare providers are more responsive and culturally appropriate to revive, support, and strengthen the definitions of health this population upholds. Indigenous-led partnerships can improve access to care, provide holistic care, better adherence to care plans, and many health outcomes by using culture as cure. When health interventions are holistic and informed by cultural knowledge, they are more successful. Barriers to providing cultural humility training to non-Indigenous healthcare workers can include misunderstanding of patients and culture, discrimination and racism, lack of staff qualified to provide training, perceived power distance between patients and healthcare providers, and a lack of mandatory cultural safety and humility training legislation. Barriers to increasing the number of Indigenous healthcare workers can include retainment of Indigenous healthcare workers, stereotypes and discrimination, lack of role models and mentoring in the healthcare field, negative job bias amongst Indigenous currently employed in the healthcare field, lack of funding specifically related to hiring Indigenous peoples, and a lack of Indigenous peoples in studying post-secondary education and careers in the healthcare field. Relevant stakeholders. Indigenous patients and communities are directly impacted and have a significant voice and perspective on improving patient-centered care to Indigenous peoples. Indigenous healthcare professionals are also directly impacted and provide a unique perspective on Indigenous care, how to effectively practice cultural humility and change norms within Canada's healthcare system. Non-Aboriginal healthcare professionals play a major role in building partnerships and becoming role models and advocates for culturally centered care at the bedside. Government and legislators work to build policies and partnerships with Indigenous communities and organizations to ensure the TRCC calls to action are met. Indigenous organizations, they advocate, challenge the status quo, and set standards for equitable healthcare for Indigenous peoples. Professional organizations, they set standards for healthcare professionals to practice in cultural safety and humility and put proper training in place to healthcare settings. Educational institutions and educators educate future generations of healthcare professionals on the importance of cultural humility in Indigenous healthcare in Canada. What strategies can be implemented to resolve this issue? On a micro level, we can advocate at the bedside for the importance of Indigenous healthcare workers providing a quality of care that non-Indigenous healthcare providers are unable to provide. This highlights the fact that they provide a cultural perspective that promotes trust and eliminates fear between Indigenous healthcare providers and patients, thus leading to positive patient outcomes and experiences. 2. Take part and advocate for standardization of cultural safety and humility training for all staff and professional organizations. Set a standard at the bedside that prevents discrimination and racism and promotes understanding and insight into Indigenous cultural safety in relation to health. And 3. Creating an open dialogue with Indigenous patients, listening to their lived experiences with health professionals, and acknowledging that they are experts of their realities. This helps to receive feedback to assess gaps and barriers that need to be addressed to promote optimal patient care. On a meso level, we can make cultural humility training mandatory for all staff and provide opportunities for staff to increase cultural awareness. This helps to maintain respectful processes and relationships between non Indigenous staff and Indigenous peoples to allow for Indigenous peoples to feel safe and unafraid when seeking out care, and increase knowledge for staff interacting with this population to play a positive role in patient care. Two, organizations need to enhance Indigenous recruitment and retention strategies to increase the number of Indigenous healthcare professionals at all levels within the organization, including creating Indigenous work experience programs, enhancing leadership development programs, supporting staff to access cultural healing and wellness supports. This would allow Indigenous staff members to feel valued, create work and learning environments where they can thrive, and thus improve awareness, challenge assumptions, and change norms, and ultimately create a more culturally safe organization that otherwise could not be as effectively provided by non Indigenous healthcare providers. And three, work in partnership with Indigenous patient navigators and outreach coordinators to ensure local Indigenous community voices are embedded in policy, planning, reporting, and evaluation processes. This recognizes that this partnership is vital in incorporating culturally appropriate practices that will allow for Indigenous communities to influence organizational change and voice the importance of implementing culturally safe practices and how to do so effectively, as well as improve the retention of Indigenous healthcare workers. On a macro level, we can insert legislative provisions recognizing matters such as the value and role of Indigenous groups in the planning and delivery of health services or the importance of cultural practices. This is to provide patients with better health outcomes and experiences when receiving medical care. Two, ensure Indigenous representation on various health related boards, committees, and regional health authorities. This is to increase control over the design and delivery of Indigenous health services and advance cultural safety and self determined in healthcare, thus aiming to improve health outcomes. Three, provide Indigenous professional associations to have a greater role, identify gaps in the healthcare system, and advocate for the betterment of Indigenous health and representation. Four, support post secondary institutions to implement cultural professional development and competency requirements, as well as implement scholarships and bursaries for Indigenous students. This is to increase incentive in the number of Indigenous peoples in the healthcare workforce and become role models for future generations. Five, release best practice guidelines in terms of approaching Indigenous cultural care. This highlights the importance of providing culturally safe care to patients and instructs on how to effectively do so. Six, provide specific funding to organizations for the hiring, training, and development of Indigenous healthcare professionals. This increases opportunities and incentive for organizations to increase the number of Indigenous workers within their workforce. Seven, recommend or mandate the need for completion of cultural humility training for professional organizations. This eliminates the fear and discrimination felt and experienced by many Indigenous staff members and patients, and aids in promoting positive patient experiences as well as staff retention. And lastly, increase public awareness of the TRCC calls to action. This would allow for increased enthusiasm and support, stimulation of action, informing and educating on Indigenous history, and motivate change for Indigenous peoples in Canada. How do we evaluate their effectiveness? One, we can analyze and compare trends from previous years to present. So we can look at the number of professional organizations requiring cultural safety awareness training, the number of overall Indigenous healthcare providers, the number of Indigenous peoples accessing health services, Indigenous staff retention rates, and the number of Indigenous students entering healthcare related programs in post secondary institutions. Secondly, staff satisfaction surveys. Asking staff members to complete satisfaction surveys to determine gaps and changes that need to be made in order to improve staff wellness, safety, and retention. Also, asking Indigenous patients to complete satisfaction surveys during or after receiving care from healthcare organizations. And lastly, quality assurance. Performing quality assurance and cultural safety awareness training by asking staff to evaluate and provide feedback on ways of improvement and then revising training accordingly. Where are we in terms of resolution of call to action recommendation 23? Recommendation 23 currently remains in progress. An action plan has been proposed but has yet to be followed through with. Efforts have been made to increase the number of Indigenous healthcare providers but remain in the development stage. Furthermore, not all healthcare professions are required to take cultural safety awareness training. We must work together as allies and act as members of the change. This starts with acknowledging, recognizing, and respecting the experiences of Indigenous peoples.